There we go. Yes. Oh, I have no idea what that was. So, good evening, everyone.
Good evening.
Welcome to Medical Mondays with Dr. O. Welcome to another exciting evening. You know, this month is Breast Cancer Month, but we've had a lot happening in our community with mental health. So we focused a lot on mental health, preventing depression, preventing suicides and stuff like that. And we are blessed. When I called on Dr. Azumah, my daughter, almost last minute, and said, look, we can still do something about this month, about breast cancer, which is flaring, unfortunately, in our communities today. And she said, yes, we'll do it. So thank you so much for agreeing to come on tonight. And without much ado, you all know me. I'm Toyin Okusomi, family practitioner, HIV specialist, and I treat substance use disorder in Maryland. This is our precious Dr. Ebere Azumah, who is also, believe it or not, very humble, our president at AMPA. AMPA is the #1 Nigerian American physician body in the United States. We are national, and she is our president in the DMV corridor. So I hand the baton to you. Take it and run with it. Welcome.
All right. Thank you so much. There are some people, when they call you, you drop everything and you run. And it's always a privilege to answer your call, Dr. O. You guys all know she's a remarkable young woman. She calls me humble, but I call her more humble. So it's a pleasure to be in your presence for another Medical Monday. Like Dr. O has just said, breast cancer awareness is really, really important. I'm going to begin the talk by sharing my screen. It's just amazing because I was in church yesterday and I was thinking about really, truly what I'm going to teach today. And I had a topic. Before I reached home, Dr. O text me, and it was the same topic. So I knew that it was divine intervention because I don't understand how we had the same topic. And you might say, okay, just breast cancer. So the topic should be similar. Yes, you're right. But this topic was specifically for one gender, and we had similar, if not the same topic. And it was like, wow, okay, I need to be here. You guys all need to be here. Maybe there's a message for someone today. Okay, so we're going to begin with this. Whenever I present, I like to make it interactive. So Dr. O is going to be manning the chat. So this picture, I got it from the CDC website, is Bring Your Brave. I love it because they use stories to send a message. Me and Dr. O, we both have a public health background. And storytelling is important, right? It's really, really important. And I'll tell you a true story. You guys know that I lead my own personal organization. Please, may we mute ourselves, please? Oh, is it me? Is it from my side? Is it from my side? Okay.
I don't think so.
Okay, please may we mute ourselves because we can lose our train of thought. But I lead and I co-founded an organization called Love Your Menses. And right now we have a certification program. Please, I'm sharing this not to talk about the organization, but more so to share the story. And one of my members, one of my fellows was like, Dr. Azumah, this girl here, she just trained someone who's so articulate. She's so good in like sharing the message. Like, I wish I was like her. And I looked at her and I said, everybody has their own community to speak to. And for you, you're assigned to speak to that community. So I like this image. And I want you guys in your chat to like write what this means to you. It says there isn't just one face to breast cancer. Everyone has a different interpretation. And I'll tell you what it means to me today and what it means to Dr. O. So if you could put in the chat what this means to you, maybe we can randomly pick answers. What does this mean to you? There isn't just one face to breast cancer. You could type it up, or you can even unmute yourself and share what this means to you. I'll give us 1 minute. Oh, I'm going to start. Okay. It affects all.
Happy
Yes.
life.
Yes. Okay. Okay.
It affects all.
Okay. Yes. Yes. You know what? Breast cancer is not a respecter of people. One, it affects all. But the most important message Dr. O wants you to know is that it affects men. You know, we have branded breast cancer to be a disease of women, rightly so, right? And you see the data that shows it's mostly women, but it affects men. And you know what? It's harder for men because breast cancer in women is stigmatized, right? No one comes and say, I had breast cancer. Like, thank God for breast cancer awareness. People are more comfortable sharing that without, feeling shame. Sometimes when you're a victim of a disease, you become ashamed as well, because I don't know, it's just the cycle of life. Maybe a psychologist can chime in. But when you're a man and you have breast cancer, the stigma is even worse. And you're going to see the story shortly. Okay. And for those that don't know me, Dr. O has introduced me to you. My name is Dr. Azumah. I'm an OBGYN board certified and also a public health professional. I love to teach, and I again thank Dr. O and Medical Mondays for allowing me to be here. All right, so the objective, you guys all know we start with an objective. We're going to review the anatomy of the breast, which is pretty simple anatomy, at least for us physicians. And then we'll talk about the risk factors. We'll talk about prevention strategies, healthy lifestyle choices, and early detection. Okay, the sequence might not be like this, but these are going to be the 5 main points that you can take from this lecture. So the anatomy of the breast, pretty simple. So the breast contains like lobules, and then the lobules, the cluster then forms a lobe, and then the lobe drains into the duct, and then the duct drains into the nipples to breastfeed a child. It's so, so, so cool when we think about the anatomy of the breast. I still, now we're talking about breastfeeding and all of that. I remember when I was a kid, breastfeeding was a thing in Africa before, the cow milk was introduced, and everybody, especially wealthy people, were abandoning, breastfeeding to cow milk. But now we're reverting back. So it's really, really cool that the good Lord knew what was needed and created the woman's body to be able to sustain life. So that's the breast. In general, the size of the breast depends on the connective tissue and the fat and the rest of the cells within the chest wall. Men also have similar anatomy, but their breast is smaller, right? Because they don't have the effect of what? Estrogen. All right. Breast cancer then is a situation when the cells of the breast grows uncontrollably. And that's what cancer is, when our cells takes over and is not controlled. There are different types of breast cancer. Again, breast cancer or cancer follows the anatomy, right? So if the breast cancer starts from the duct, it's called an invasive ductal carcinoma. Carcinoma just means cancer. And then if it affects or starts from the lobular region, then it's going to be an invasive lobular carcinoma. And then there's a stage 0, like ductal carcinoma in situ. Again, that's not the crux of this lecture. It's just so that you know that you heard it. What are the symptoms of breast cancer? Any change to your breast. So it's very important to know your baseline. I'm so glad medicine is switching back to preventative care so that people can understand their baseline. Because if you understand your baseline, then any change you can correct or you can fix. I call breast anatomy, I call the baseline of your breast exam, your breast anatomical baseline, just like the point of what it does. So I advise my patients that come to me to know their breast. Know your breast so that if there's any change, you can let us know. I think 40% of breast cancer is caught by women, right? When they're doing their self breast examination, SBE, that's how they catch it. So if you know your baseline, you can know when there's a change. You can even recruit your partner to do the breast exam with you, create activities between you and your partner to maintain your relationship. All right, so some facts. 1 in 8 women are at risk of having breast cancer in the United States. 1 in 8 is pretty extensive. And that's why we have the bias that breast cancer is a woman's disease because of the high prevalence. But the truth is it also affects men. So what can we do? We have to know our family history. And we're going to hear Lisa's story shortly. Another risk factor is the genetics factor and age. Age is very important. The greater you are, the older you are, greater than 50 years old, that's when your risk for breast cancer even gets worse. Postmenopausal breast cancer. Gender, as we've stressed, is more common in women. However, 1 in 100 breast cancer diagnosed in the US occurs in men, so about 1%. And then we have hormonal factors and also lifestyle factors that affects the risk of breast cancer. All right, so let's go. Let me see. Let's see if I can play Lisa's story. You should have played on its own, but it's okay. Can you guys hear this?
My cousin Veronica was
Can you hear
diagnosed
it?
with breast
We can hear
cancer
now.
at
Yes.
38, and she's just a year older than I am. In my family,
Let me start all over again, please.
my cousin Veronica was diagnosed with breast cancer when she was 38, and she's just a year older than I am. In my family, there are a total of 6 women who've been diagnosed with breast cancer. 4 of those women were under the age of 50 when they were diagnosed. The first person diagnosed was my Aunt Martha. She was 39 years old, and I was 19 years old. Then when another aunt became diagnosed, and then another one, it started becoming way too real. I had the conversation about breast cancer before my son was born, but once my kids were born, everything just amplified, I guess you could say. All of a sudden, now I have children to think of. I have children I want to be there for. Finding out that Veronica had cancer and us both having young children, it also made me very aware of how I could possibly be the next person in my family, to be honest. I started talking to my doctor about it when they were asking me about family history, and they found out how many aunts I have with breast cancer. Knowing my family history of breast cancer helps me manage my own risk. It can be hard to start this conversation with your family, particularly if they're private. If you have a family member who has a gift about talking to others, maybe you can use them to help relay the information to you. My family history with breast cancer doesn't predict my future, but it does help me make more informed decisions about my future.
All right. Who can tell me what the keyword here is? Well, keywords, type it out. Please, let's see the chat. Why is Lisa's story important? Okay, this is an interactive session, please.
Type your answer or raise your hand, unmute.
Thank you. Someone has typed.
Family history of breast cancer.
Thank you, Miss Mary. History, exactly.
History.
It's very important for us to know the history of our family. You know, when you're having your Thanksgiving dinner soon coming. Talk about your family history. There should be no shame. Lisa's life was saved because she was aware of her family history. She saw her cousin, Veronica, who is 1 year older than her, have breast cancer. She knew that she needed to talk to her physician, and she did, and they caught the cancer early. And now she's alive to take care of her 2 children. So for the sake of your family, especially those that have children, please ask about your family history. That's very, very important. And keep it private if the person suggests they don't want their names, listed, or they don't want anyone to know it's Auntie Veronica that has the breast cancer. You could just say someone in my family, cousin, has a breast cancer. But please, please know your family history. Okay. All right, we stress that. I also want us to hear Charity's story, because Charity's story is also important, and someone would help me eventually share why Charity's story is important. Thank you again for participating. I appreciate you all.
My name is Charity. I am 31 years old and I live in Washington, D.C. For fun, I like to do stand-up comedy.
Welcoming to the stage.
Around September of 2012, I felt a lump in my breast. I went to a doctor and they figured that I was young and I should just probably keep an eye on it. If it got worse, come back. Gradually, over time, it was progressively getting worse. And about 3 days into being in the hospital, the cancer had eaten through my breast. I really didn't have time to sit and think about what was going on, what was going to happen. I went through total 8 rounds of chemotherapy, double mastectomy, non-skin sparing, and then I went through 33 rounds of radiation. I decided to get genetic testing and counseling, and I tested positive for the BRCA2 mutation. I'm predisposed to breast cancer, ovarian cancer, skin, pancreatic, and stomach cancer, which is scary in its own right. I decided to be proactive in my health. Having BRCA2, made the decision to have both of my ovaries removed. It was a big decision for me to make, single, never had children, and I was in the middle of chemo. After everything was over, it was a real shock to kind of like get back into, normal life and trying to decide what was best for me. Humor is my way of getting through difficult things. Always has been, probably always will be. And I felt like I needed to share that with other people. I felt like I have a story that's not really like anyone else's. I think doing the comedy allows me to tell people that breast cancer just doesn't happen to someone that's 75 years old. You need to take your health seriously. Talk to your doctor. There isn't just one face to breast cancer.
Right. Thank you again. Can people type in the chat why I selected this story? Something important about Charity's story.
Dr.
Please.
Akindele wrote again the importance. He wrote again the importance of family history.
Okay. Okay.
Any more?
Please. I was able to get 1, 2, 3, 4 different.
This is good. Early intervention and being proactive.
Awesome. Mary should get a prize. Mary should get a prize. Please, if you have, give it to Mary. Mary understands this. Mary, you got to tell us why you like this subject and why you're very
she's a clinician. She's a clinician.
Okay. See, I knew there was a reason. Thank you.
So,
thank you.
History.
Yes.
Okay. So Sister Wumi wrote, I missed something. I saw something before. Early intervention and being proactive. I thought Sister Wumi wrote something that misdiagnosis. I saw that.
Yeah, that's a good one.
Yeah.
More, please, especially from non-clinicians. I know misdiagnosis. Yes, you misdiagnosis. That's a very good point. Thank you for bringing that up. Non-clinicians, please chime in.
She's a non-clinician.
She's an attorney, right? She saw that one quickly. Am I correct?
No, she's not. She's not an
Oh,
attorney.
she's not an
either.
attorney.
Yeah,
Okay.
she just has brains.
Okay. Like misdiagnosis, call me 24. Okay. Okay. Please,
Yeah,
more.
because I think the misdiagnosis
Genet-
is
genetic
critical.
anal- Sorry? Go ahead.
I said misdiagnosis is critical for cancer, right?
Yes.
That's
Yeah,
a big
Yes.
issue.
right on point. Right on point.
Yes. Yes. Yes.
Genetic analysis, Dr. Zugu said genetic analysis.
Yes. Yes. Yes, Dr. Zugu. Okay, one more, guys, please.
What
So
about
my list, which
what
I'm,
about-
I'm writing as go
what
ahead.
about attitude?
Attitude. Yes, that's a good one. That's a great one. Great one, Dr. Fo. So some things that I wrote is we saw in Charity's story, the management for breast cancer, right? I don't know if you guys paid attention to the fact that she got chemo and she had radiation. She also had her breast removed called mastectomy bilateral. She also had her ovaries removed because she had a genetic disorder, BRCA2, that led to this whole problem. We also saw how she caught it early, right? Because of self-breast examination, okay? So these are keywords I want you guys to be using from this story. And Dr. O reminded us attitude. So now she has the diagnosis of breast cancer. She's been managed. What is her role, right? So she changed her lifestyle. You saw she began to exercise. And it's important, lifestyle modification, meaning preventing breast cancer. And after you've had breast cancer, not you, but someone else, after they've had breast cancer, what can they do apart from the medical management? So we're going to continue. Thank you. You guys are awesome, awesome, awesome. All right. Okay. All right. So we've seen Charity, we've seen Lisa. So let's focus a little bit on Matt. Okay. So one in 100 breast cancer diagnosed in the US occurs in men. So 1% of breast cancer. President Joe Biden, our current president, has designated October 17 to October 23rd to highlight that breast cancer also happens in men. 1% is not a small number in the grand scheme of things. It's about 2,700 American men this year would be diagnosed with breast cancer. Unfortunately, 530 of them might die from the disease. And you can find more information from breastcancer.org. I want us to watch an important story as well from Paul Dombrowski. He's an NFL player that was diagnosed with breast cancer. I think his story is very important.
New at 6, despite what most of us may take for granted, women aren't the only ones who should worry about breast cancer. It strikes men as well. Catching it early is critical, but Ursula Perry shows us how most men don't even consider that they could have it, let alone watch for it.
Paul Dombrowski pushed his body to the limit to reach the top.
Dombrowski intercepts.
Not only did he make it to the NFL, the former Buccaneer was a two-time Player of the Year for the Patriots. Then, breast cancer lined up against him.
I was yawning, and I lifted my arm up, and I ran my hand across my chest, and I felt a lump. And immediately, I knew it was breast cancer.
He was shocked, but right.
Now I'm going to get a mammogram. So, first thing I do with the tech is like, how do I get this into that?
The tumor was detected and removed early. Good news for Dombrowski. But he still worries about other men.
We can call it your chest, you can call it your pecs, they're breasts.
Nicole Figueiredo says men's breasts are built much the same way women's are. In 2018, more than 2,000 men will be diagnosed with invasive breast cancer.
Unfortunately, a lot of men with breast masses fail to go to the physician. That leads to breast cancer in men being diagnosed at later stages.
Here's what to watch for: a firm lump behind the nipple, an itchy, scaly rash, any change in shape or size, an inward pulling of the nipple. Thanks to his vigilance and preparation, though, Dombrowski can now list professional football player and breast cancer survivor on his resume. Ursula Perry, KSAT 12 News.
Yep. So help me again. Document keywords that you've seen in this story with Paul.
Early detection.
Yes, yes, yes. Thank you, Cleopatra. Thank you. What else, please?
Taking action.
Yes, exactly. Yes. Thank you. Thank you. Hey, Mary's just working this self-examination. Yes, 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 yes. Omatara, thank you. Being proactive. Yes. Wumi, that's your word. Proactive, proactive. You know what? That's it. Proactive. I like that. That's going to be the take home, proactive. What else? Did you guys hear from his voice? Like the stigma? Did you guys hear it, or is it me? Like when he said a mammogram, like my breast entering the machine, like how, So he also had the stereotype of mammography, right? He had the stereotype that as a man, he shouldn't be doing the test. He also had a stereotype like small breasts, can I get a mammogram? But we know not every woman has large breasts. So, but you could see it. But in the end, I love how Paul is transparent that breast cancer happens, and he was aware because maybe his background, and he wishes and he hopes more men would do the same thing. Let's see. So,
Mary says self-education.
Yes.
Sister Rosemary said, I wonder how he got breast cancer while looking very fit.
Wow. That's is that a question, a statement?
It's a question. She wonders how he got breast cancer while looking very fit. So it's important to talk about does fitness exempt you from breast cancer? How do breast cancer? Yeah.
That's a good one. Let's go back. Thank you for bringing that. Let's go back to what we first started with, right? We talked about risk factors, right? So some people have the genetic risk factor. Maybe Dombrowski has that genetic risk factor for him getting the breast cancer. The question we would ask ourselves is, would he have gotten it earlier if he wasn't fit, right? Because we know lifestyle matters. Studies have shown the healthier you are, the less likely you would develop breast cancer. Or another way to look at it, which Charity was the second lady, the one that had a mastectomy. What you do after the diagnosis also has an effect on your prognosis. Prognosis is your life expectation after the disease. Does that make sense? I can't see your face or faces, so I don't know. Dr. O, do they look confused or did they get it? Someone raised their hand. Okay. Dr. O, can the person that raised their hand speak, please?
Yeah, it's me, Tawa Durajay.
Thank you, Tawa.
Hey, Ebere, how are you? So
good.
At times it's confusing, honestly, because I have a member of my family that had this last 10 years ago, and it came back again. And I can't believe. I did BRAC A1 and I just did the 2 last month and it was all negative. So how many times do you have to do it before you know that, okay, maybe? And she's very active. She wakes up at 4 o'clock. She's a doctor herself. She wakes up at 4 o'clock. She goes to gym every blessed day except Sunday. And still, this thing still happens. So what do you do?
Wow, that's a loaded question, but I invite Dr. O to step in. She knows this topic just as well as I do. So the question is, one, the accuracy of genetic screening. I believe with current technology, the accuracy is pretty high. One, okay, so your result is the truth. Okay, so let's praise the Lord for that, right? So you don't have the genetic risk factor for having BRCA related breast cancer. Okay. The second one is your cousin that is very healthy, yet she has a remission of her or reoccurrence of her breast cancer. Why? When people do all the right things and they still have an outcome like that, how I encourage them, I might not be telling you the answer, but how I encourage them is like, sister, your destiny, your health destiny was bad, but you modified it. So maybe you're like 50 and you're manifesting this disease. If you didn't have a healthier lifestyle, you could have been dead. But because of the grace of God, you did what you're doing and you're alive, because all of us have a different genetics predisposition. So her genetic predisposition was for her to, in my opinion, get this diagnosis earlier, but she did the right thing. So she shifted, right? It's almost like Hezekiah in the Bible when it was declared that he was going to die. He went to God and God extended his life. So everybody comes in with different familial predisposition, but we can do things to modify it. So instead of us worrying too much about like what or why, I always tell people to remember that what you've done has modified it, because your destiny, your genetic destiny was different, but you changed it. Similarly, if someone has a genetic predisposition of living long, but they go and be eating, eating fast food every day, you cannot cheat nature. Your genetic predisposition will shift, right? Because in life, there are many variables in manifestation of whatever, right? So there's the God, then there's us, and then there's the environment. So it's the same thing. That's how I explain it. I don't know if that will help you, but that's how I explain it, because there are just a lot of things we cannot explain. Tawa, does that make sense, or am I confusing you more?
Well, you're not confusing me, but I just don't, I try to think about it. I try to reason it out. This is the person that right from beginning, when organic food is not even common, all what they eat in their house is organic food, organic. So if it's somebody like me that my mouth is sweet, I eat some other stuff, but she's not. She's strictly organic, strictly this, strictly that, and I don't know what to say.
Okay, let me refer to Dr. O, so Dr. O can, use her wisdom and experience, explain or give us an answer. Dr. O.
Well, thank you so much, Auntie Tawa. I've learned something in medicine, that to take everyone with a grain of salt. You see people who come and they say that they do this, they do that, but on questioning, one may find out that one particular thing they do is so contrary to good health. Now, when we talk about breast cancer, we know that there are multiple factors. Genetics is one. We found out that diet also is a problem now. There are things that people eat that can predispose them to getting all sorts of cancers, including breast cancer. Obesity is another thing. When people talk about obesity, you're looking at weight. And thank God I happen to know, the cousin you're talking about. When you're talking about weight, when we're talking about weight, right? But the weight all over the body does not actually cause problems. Is the weight around the stomach. Truncal obesity is what causes problems. So that being said,
I didn't get what you said last. You said the weight around what?
Around the stomach. Truncal obesity. The weight is so important that it has its own name, truncal obesity. So you see somebody who doesn't have weight on them, but they have this round tummy. What is the tummy doing? So that being said, we talk about organic foods. If you research, you will see that some people claim the food they sell is organic or something is organic and it is not.
Good call.
And, you know, the organic foods that we're talking about themselves, do you know that they actually, believe it or not, ma, they use,
Fertilizer.
they use fertilizers also. I asked the naturopathic doctor, what is in your fertilizer? And he did not answer my question. So there are fertilizers that are used, but they're different from the fertilizer that, you know, people who it's non-organic food use. Now, that being said, you know that it could be fertilizer in foods like that could have a reaction in somebody, but not in another. I'll give an example. When pharmaceutical companies make a medication, the first pharmaceutical company that makes it, we know that that is a brand, you know, of the medication. And they use fillers, certain fillers, to make it into capsules or tablets or what have you. But then, 14 years later or so, other companies are allowed to make the same medication. They have to have the core ingredients, you know, the active ingredients in them, like the brand, but they use different fillers, any other fillers, to make their generic drug, so that then the drugs become cheaper because their fillers are cheaper. You know that some people tolerate the brand, but don't tolerate. And some people tolerate generic and don't tolerate brand because of the different fillers. So bringing it back to what we're talking about, food, the fertilizer in this organic food may be a problem to the person eating it, whereas fertilizer may not be a problem to them. Until we actually get exposed to things we don't know. So we need to understand that we don't have all the answers for why people get cancers. But looking at somebody and saying that they fit, they do this, they do that, until you actually live with them, until you actually see what they're doing, you don't know. And even if you live with them, they still could be doing everything right. Who knows how the body is reacting to what they put in? We don't know.
Wow. Thank you, Dr. O. Let's bring Dr. Adebowale to chime in. Dr. Adebowale, why don't you chime in a little bit, because you have a lot to say. I like your comment, breast cancer is no respecter of anyone. Do you want to respond to that? Sorry for putting you on the spot, but I think you have a lot to bless us today with.
You know what, before she comes on, I just got some things here that environmental risk factors also exist. We talked about the genetic, we talked about nutritional, there is stress. We've identified that stress is a big one. And Dr. Kapp, who sent this to me, is as PhD in oncology. So she's giving us the depth of this. Stress is another one. We've identified that by research, that it can cause cancers, especially breast cancer. Increase antioxidants to combat environmental stuff. Hair dyes, dye that you put in the hair, shampoos, lotions, these things can predispose to cancer. Oh, Auntie Tawa, I'm sure you remember this because you and I, we've discussed this with Dr. Bill, you know, and all before Medical Mondays. Antiperspirant deodorants that has aluminum also can predispose to breast cancer. So this is somebody who is eating well and all of that. She uses antiperspirant deodorants. What kind of?
And also mutation too, the genes mutate.
Well, this can mutate also, you know, so there are many factors. Thank you so much, Dr. Kapp, for, you know, that input. So, Mary, would you like to comment?
Yes. I just put like household
Items.
stuff that is used for cleaning.
Mhm.
I like today I saw a patient, and this is far from breast cancer, so it was. I'm just gonna use that as an example. So she never smoked, and she had, I think it was pulmonary fibrosis. But then she told me that she worked cleaning, so she got all this lung issue from work, like cleaning
Yeah.
items. So that was what she got, how she got that. So with breast cancer, it might be a lot of things. Some people you just have no idea. I've had friends with breast cancer. I have one that is actively dying from breast cancer. She's on hospice already. She went through, yeah, she's in her 50s. She went through chemo and everything, and she did everything right. So it's breaking my heart right now, even talking about it, because we don't know when she's going to be gone, but she's already on hospice.
Thank you
And
so much.
yeah,
Thank
so there
you.
are a lot of things, and we just don't know sometimes.
Thank you. Dr. Elukweju wrote in the chat box that breast cancer is unpredictable, and it is unpredictable.
Yes.
Go ahead, sir. Dr. Elukweju is also an expert, OBGYN. Go ahead, sir.
I mean, yeah, great topic, especially for this month of breast cancer awareness. Yeah, it's unpredictable. There's no question about that. There are women that have all the risk factors that we've been talking about today, and they don't get breast cancer. Some women that don't have any of these risk factors, and they get it. It cut across all races, all shapes and sizes of women. Have breast cancer
And
in
men,
Nigeria.
and men, right? And men, doc. And men, you got to put men there.
Amen.
Uh-huh.
Dr. Azumah,
Okay.
yes, sorry. We have breast cancer in Nigeria, in India, everywhere. You can take, like we said earlier, 1 in 8 women. So people have friends, who have it, and many other people who don't have it. And, you can talk about diet. Don't eat this, eat that. People eat the same thing.
Yeah.
And some people will get it, and some people will not. Fertilizer, this, that, fatty, food and all that stuff. And there are people that eat fast food all day long for years and years and years, and they don't get it. So the gist of the story is the awareness, early intervention, which is basically the gist of this discussion today. Get your mammograms, do your breast self-exams, see your primary care physicians, and just do your yearly checkups. And that's basically what one has to do. But it's basically unpredictable, and you can strike anyone. And that's basically what I said. Yeah. Mm-hmm.
Thank you so much, sir. To both of you, because you're both experts here. And Dr. Cap, you're listening. What is the role of weight, obesity in breast cancer? Because there has been researchers looking into, when people when they have weight on them, they say they have increased estrogen. And so that can predispose to increased risk of breast cancer. Can you guys comment on that, please?
The theory, and then I'll hand it to Dr. Elukweju. But you guys, I'm not going to share my slide anymore because Dr. Elukweju summarized everything. And let me just summarize it so that we can go to quickly the open discussion, because Rosemary wants to talk as well. We'll give you the platform shortly. So Dr. Elukweju summarizes it well. Breast cancer is unpredictable, unfortunately. However, we have people with risk factors. The question is, which ones are modifiable risk factors? And modifier risk factors would be early intervention. So early detection would increase your prognosis. For example, if we detect breast cancer at stage 0, your 5-year prognosis, like survival, is like 99%, right? So catch it early and you will survive. It's very important to get the annual mammogram. Very, very important. There was one time, Doctor, I didn't forget your question, is in my head. There was one time where some people argue to get screening at age 50. Most African-American physicians disagreed because most Black people tend to have the most aggressive breast cancer and said, no, we will stick with age 40. So it's very controversial, but luckily, at least in the United States, most insurance company would pay for it. But you see some people starting at age 50 instead of age 40. But we stick, like in my practice, which I'm still in the clinic right now, we start at age 40. So early intervention is important, and awareness. And what are the awareness? I have some pictures. It means like getting your self-breast examination for those that are premenopausal, meaning you've not reached menopause. Menopause on average happens at 53, but it can start at age 40. If you are premenopausal, do your breast cancer screening 10 days after your period, because at that time your breast is not tender, the effect of progesterone is less. And then those that are menopausal, meaning no menses, or postmenopausal 1 year after menstruation, choose a date. This is what I tell my patient. I got it from another surgeon. What's your birthday, right? Some people's birthday is on the 7th, right? So for example, I'm born May 7th, so I'll choose the 7th day of the month. So it's easier and, for me to remember. And what are the ways for self-breast examination? One, you choose the position you want. Do you want to do it standing? Do you want to do it lying down? So once you choose the position, you now visualize your breasts, right? Like when you go to the doctor for clinical breast exam, clinical because it's done by a clinician, we always inspect the breast. So you're going to be doing the same thing by inspecting your breast. You look in the mirror, you pose, and you look for asymmetry, any changes like bigger size. You should know your baseline and then compare it. Then the next thing will be palpation. When you touch your breast, we say use your 3 fingers and then the flat palm of your finger and then go around. Whatever is important to you. The main point is to examine all the tissue. If there's anything hard, anything tender, please go to your doctor. And then the next step will be imaging and so forth. So it's just, I wanted to summarize it. And now we're going to go back to Dr. O's question. Dr. O asked, why does obesity increase your risk for breast cancer? My theory, which she answered the question, was estrogen, right? Estrogen is very important for the enlargement and growth, right, of the breast cells. So the same way, if there's too much estrone from the fatty tissue, very uncontrolled kind of estrogen, it can trigger the effect of excessive growth. And that's the theory, I would say. But I would pass it to my colleague, Dr. Olopaju, to see what he thinks. Thank you.
Are you talking about me?
Yeah.
Yes, sir.
Yeah.
To answer her question.
Yeah, okay. Who does?
You. Do you have a comment on that?
Yeah, the comment she just had is very timely. With all this, she said it all. You have to live right. All those risk factors definitely is very important. Exercise, eat well, sleep well, lose weight, because definitely estrogen, is made in the fatty tissue. So it tends to, occur more in people, who are fatter than others. So all those, living well, all the stuff that we all know that we don't do, it's very, very important. But at the end of the day, like I said earlier, it's very unpredictable, and I've seen thin women in my practice who came down with breast cancer. And I've also had, overweight women that come down with breast cancer. Same thing with ovarian cancer, uterine cancer, name any cancer that is out there. Like I always said, everybody's going to develop something. The question is, what is it? That's just a given, but, so it's only by the grace, only by the grace. So prayers, living well, doing the right thing, seeing your doctors on time, that's very important. Many of us, Black people don't see our doctors. We don't see our primary care for our yearly exams. That's very important. I used to do mammogram for my patient at age 35 as a baseline, because like she said, Black women tend to, Black people in general, we tend to suffer from things worse and earlier than other races, so sometimes the insurance company won't pay for it, but I stood my ground and I started my baseline at 35. So, early intervention, awareness, we come from countries in Africa where we don't have anything. So our women only just, live there taking chances, and pray, so there's no answer to this illness except early intervention, seeing your doctors on time, doing your mammogram, and then pray.
Thank you so much, sir. Before Sister Rosemary comes on, I was hoping that Dr. Cap would come on and say some things, but she just told me a lot of things. Obesity, exceptionally prevalent in the USA, promotes the incidence and progression of numerous cancer types, including breast cancer. Complex interacting metabolic and immune dysregulation marks the development of both breast cancer and obesity. And she sent a link from PubMed, the obesity breast cancer link. So there's a link between both. And she also said that obesity promotes chronic low-grade inflammation. This is why, particularly in white adipose tissue, which drives immune dysregulation, marked by increased pro-inflammatory cytokine production, alternative macrophage activation, and reduced cell function. Breast tissue is predominantly composed of white adipose, and developing breast cancer readily and directly interacts with cells and signals from adipose remodeled by obesity. So let me just say what all that means in one word. Obesity causes inflammation or predisposes to inflammation, which in turn, especially in these white adipose tissues, which the breast happens to be comprised of too. So the chances of somebody getting breast cancer. But she said, the research is still ongoing. And so weight is very important. What we put in our mouth is important, and weight is very important. So there's an important question in the chat box, but Sister Rosemary, kindly unmute and give us your contribution. Ask your question. Thank you.
Azumah and Dr. Lupeju, Dr. O. I have two questions. I know a guy that had breast cancer. Prior to that, he had prostate, colon, and other type of cancers. With that, I just want to find out if the other cancers triggered the breast cancer for the guy. And secondly, this particular person was full of hate, and would that trigger it also? Because someone spoke about stress. Those are the two questions. So right now, the guy, he's been dealing with this cancer for a very long time. And after going through forgiveness therapy, he's doing very well. His mental well-being is very, very good right now. And this guy, doesn't even talk about hatred or anything anymore. No negativity around him. And he's doing well. He's been able to manage that cancer for the past 20 years.
Wow. Wow. Excellent question. I'm going to take some of it and then you guys can join as well. Your question is a good sequel to the response that Dr. O just read, right? So we looked at the theory for why obesity causes breast cancer, right? So one theory is the stimulation of estrogen, which causes rapid growth and uncontrolled growth. The second is the effect of chronic stress or chronic inflammation. So now you see the key correlation. Stress also causes chronic inflammation. Okay, so chronic inflammation can also trigger it. There are many triggers. So yes, stress, any kind of stress. It could be obesity-induced stress, environmental induced stress, like just, heat. But we see that happening. And the other thing is doctors, yes, we love science, and God has given us science as a way, in my opinion, as a physician, I humbly say, as a way of showing mercy, right? Because those of us that are Christian believer, we know sin brings forth diseases, not just individual sin, but as a community. But God in his infinite mercy has given us a tool to save life. And that's where medicine come in. And that's why we physicians, we feel special, right? Not just because we're intelligent enough to do it, not that part, but because we are co-healers with the Lord, right? It's a special calling for all of us. But with that said, there's just so much we do not know, and I'm glad now medicine is open to like learning different things. We're seeing the effect of prayer in the brain. There's just so much we don't understand yet, but I'll beg to differ that stress can cause or stimulate the worsening of breast cancer. So that's one. The second one is the case study you presented about a man with breast cancer, prostate, and then colon. Most likely he has a syndrome, most likely maybe a BRCA gene. Whenever you see like different organs being involved in breast cancer and it's not a metastasis, I don't know if you guys know what metastasis is, but just so that we're all on the same page, it just means like spread from one location to the other, right? So sometimes with advanced disease stage 4, you can see a spread from the breast to the spine and whatnot. So if it's not metastasis or metastatic disease, then when they're in different organs, most likely it's a syndrome. And it might be a syndrome that we have not yet identified as physicians. I'll throw it back to Dr. Olupaju.
Dr. Olupaju.
Yes, Dr. Azumah has said it. There's something called mind over matter. I see human beings as very mysterious creatures, and that's all we are. We have the body, which is basically made of sand, and then the soul. And when we die, the body is right there, but the soul is gone back to where it came from the maker. So this guy who, changed his ways from being very negative to being positive, and is doing very well. That's just, the power, of being that we are. So like Dr. Azumah said, that person probably has some type of gene that predisposes them to having different type of cancers. Getting back to Africa, where we came from, our people have all the same issues that we have here. Many people die, and we don't know what they died from. Nobody has done enough studies in Africa to know about the genes, whether we have, family history. We just see people that develop something and they die, and people think that somebody did something to them. So we have, work cut out for us not to turn our back on Africa, to see the best that we can do for those people. And but once again, it's mind over matter. And if you do good things come to you. By the end of the day, once again, prevention, early intervention, and doing your checkups is the gist of this discussion tonight. Thank you.
Thank you.
Thank you. Sister Rosemary, was your question answered?
Yes, thank you.
I just want to emphasize the need for forgiveness. and the removal of hatred in our hearts. You know, God is always right. He cannot be wrong. He will say that we should forgive and bear no hatred. There's a reason. It's because of us. It's the consequences of stuff like that. Look, the misery, people who are unforgiving, the misery they live in is incredible. I've watched it, and it just doesn't fail to amaze me. So I encourage everyone on the platform tonight that if you're bearing any grudge or anything against someone, resolve it.
Very
So
powerful.
it doesn't become a health issue, please. Thank you. Thank you, Sister Rosemary, for bringing that up. There's a question in the chat box that is really deep, and I left it to now for us to talk about. It says, with honor and dignity to all. Again, with respect and kindness, please provide more details on what everyone should pay attention to. Is it true that breast cancer does or doesn't affect men with homosexual inclinations? We just heard about the NFL athlete. What's the best perspective on breast cancer across the board? So basically, does homosexuality protect against breast cancer? Sister Rosemary, do you have a question to that? Okay, cool. Dr. Azumah, or Dr.
Wow.
who wants to
Sorry,
start?
can I answer?
Go ahead.
You want to answer? Okay.
Sister Rosemary, go ahead.
Yeah, because someone told me that if someone suck your breast, you won't get breast cancer. So is that true or not?
Okay, so let's hold on to that. Let's
Okay.
answer this question, and then we'll visit that. Go ahead.
All right, so that's a very good topic. Even Rosemary's question is so good that I'm like, I want to answer it so much. Like, it's so cool. Like, who's sucking your breast, the kid or a partner? Anyhow, let's focus on the topic at hand. So does homosexuality affect or increase your risk? You know, I haven't seen any data that shows that homosexual men have more estrogen than others. So the question here is to ask that question, right? Why would someone that identifies as homosexual and practices homosexuality have breast cancer or be protected? So there's no correlation between the amount of estrogen. Like, if you have more estrogen, then you become a homosexual. So I would say that there's no correlation and it doesn't protect or increase your risk. Maybe we can argue that certain diseases, maybe it's more prevalent in homosexuals, can increase their risk, right, of having breast cancer. Let's say, for example, you have any disease that you think happens more to homosexual men, then they might have an increased risk of breast cancer. But in general, without that confounding factor, meaning any disease that person might have, then there's really no correlation. Dr. Olupajo, would you agree with me?
Yes, I do. I mean, you already said in the beginning that only 1% of men, have breast cancer. I mean, so that means, a study has to be done to see which men actually get it. That 1%. Are they mostly homosexuals or people who are not? And it would be difficult to really find any correlation at all. Like we said, it's unpredictable. Those men who has it probably have a genetic predisposition to it as well. One thing we need to know is that those men that get it, are they mostly obese, than others? Because we all know that there's a correlation between obesity and many types of cancers as well. But to say that homosexuality will prevent development of breast cancer in men, I don't see any correlation.
Thank you so much, sir. Thank you.
Yeah.
Sister Rosemary. Who is sucking whose breast to prevent breast cancer?
I mean, someone to
Is he a partner? Is it baby sucking the breast? Which one?
men like their breast to be sucked also. So with women, likewise women. So they said if your breast is being sucked, you won't have breast cancer. So
By
I
a
don't,
partner?
by partner, yeah.
By partner. Okay.
By partner, yes.
Okay, so I throw it back to the doctors. Dr. Azumah, Dr. Lukweju, does romantic breast sucking prevent breast cancer?
My answer, Dr. Lokweju, we should have like a paper and say, and let's say, my answer is yes, but not a man. But if you're breastfeeding a baby, right, I would say it's protective. Breastfeeding is protective. So you're right. It's just the way you phrased it, you can take it the other way. I'm not blaming you for phrasing it that way, but breastfeeding, so you have to be producing milk, will be protective from breast cancer. So you're correct. I don't know. Again, maybe if a partner sucks your breast,
maybe Dr. Lukweju may know that. May know the partner.
let me ask the question here. That did you watch the WhatsApp video? Is that why you said that? Because there's a video going around where this pastor.
Breast sucking is very, very good. So I believe that it will help, with preventing you from getting breast cancer. Everybody loves their breast to be sucked anyway.
Yeah, there's a pastor that was sounds very funny, but I'm sure many of us have seen it. That was preaching in the church, and actually the whole sermon was sucking breast. I'm telling all the congregation to suck breast and all that. It prevents breast cancer. But I mean, Dr. Azumah said breastfeeding. But that's when the baby is very, very, very young and the breast is full of milk, So adult sucking of the breast is totally different. The milk is not really coming out. If it does, might be just small amount of milk coming out.
So if it does, we have to check the thyroid.
Exactly.
It's probably thyroid problem that caused the milk to be coming out.
Not just that. Hyperprolactinemia, galactorrhea,
exactly.
The pituitary problems. Yes. So and the amount will not be enough to really make any difference. So why nobody's going to legislate against sucking breast, I don't think it has anything to do with breast cancer development or not. That's just my own take on it.
Thank you.
Yeah.
Oh, Dr. Azumah, go ahead.
So you remember I told you I had a hard stop. So I'm going to hand it back to you guys. I want to remember, Dr. O, I had to go early. Remember, it's now 8:14. Okay. So I want to thank everyone for allowing me to come and grace your presence. There's a key word that Dr. O said. It was a little bit not what we planned on, but moved by the Holy Spirit. She talked about confession. And you guys know what James 5:16 says. It said, confess your faults one to another and pray for one another that ye may be healed. So a lot of people, spiritually have diseases secondary to unforgiveness. So it's very important. And then I have one more comment, a piggyback from Dr. Lukweju. He talks about different seasons. We know that in life, there's a mixture of valley experiences and mountaintop. But if you're a person of faith, no matter what season you are in, especially in the valley, what does Psalm 23 says? He will walk with you through the valley. Thank you. With that said,
thank you so much.
Dr. Azumah,
thank you.
Dr. Azumah, it's a pleasure meeting you.
Thank you, sir.
For the participation and the lecture. Yeah.
Thank you, sir. Thank you, guys. Bye-bye.
Somebody just shared in here that I want to follow up with what she just said. She says, share your thoughts, please. Proverbs 5:18-19. Says, let thy fountain be blessed and rejoice with the wife of thy youth. Let her be as the loving hind and pleasant roe. Let her breasts satisfy thee at all times, and be thou ravished always with her love. So that's from scripture, supporting Sister Rosemary.
Yes.
Proverbs 5:18-19. However, you know, Sister Rosemary, we are scientists. Until we do the research and it shows us indeed that, you know, the sucking of breasts beyond the breastfeeding time when you're breastfeeding a baby protects against breast cancer, we will not, you know, share that as a fact. We have to have scientific evidence before we can do that. However, it's a good thing for a man to enjoy the breasts of his wife. Thank you for bringing that up. And thank you so much, brother, for sharing. Dr. Ilukweju, any comments on that, sir?
No, I mean, like you said, you have to back everything up scientifically, you know. The question is, like you said, you know, between the partners, whatever you do within the confines of your home, you know, it's okay, you know, as long as both partners are okay with it. Scientifically, you know, it will be difficult to prove. The question will become how much sucking of the breast, you know, for how many years, you know, and all those things, you know, all those variables will make it difficult to relay, you know, but as far as we know, there's no scientific proof, you know, but biblically, anything is possible.
Yeah. Thank you. See, I love that. Thank you so much. See, Auntie Tawa, you have your hand raised, ma. Kindly unmute.
I just want to say the family member that I mentioned breastfed all our children for good 2 years.
Each child.
During the time when one of them is being breastfed, that is when they found that she has breast cancer and she had to stop.
Mm-hmm. Yeah.
So
like we said, there are many variables.
It should have helped her 2 years in this country for each child, and she has 4. Oh, I don't think sucking does anything.
Research has shown that breastfeeding actually is protective. Like we shared before, the cause of breast cancer is multifactorial. There are many reasons. So breastfeeding is protective, but who knows what else, you know, she has in her life that could have predisposed her. It's tough. It's tough. You know, Dr. Ilukweju mentioned when he was talking about men that, you know, it'd be interesting to see the men who have breast cancer, that 1% of those, of the population of people who have breast cancer, he said it would be interesting to, you know what their weights are. Are they overweight? Are they overweight? But we saw the athlete who was, you know, I mean, epitome of excellent health, who developed breast cancer, and he had the gene. So you cannot change genes. So if she has the gene, there's nothing she can do about it. You cannot change your genes. You can breastfeed, you can eat anything, you cannot change that gene. All of those good lifestyle changes will just maybe prolong the time to which
she did the break 1 and 2, and they are all negatives. Well, what they said is a mutation. It's not a gene. And I did the same thing. It was not gene.
I will repeat that it is multifactorial. So there are other factors that cause breast cancer. And I made that example of the genes, that when you can't do anything about the genes, you know, whatever else you do, there's nothing you can do about the genes. We know of Angelina Jolie. I hope I pronounced that well. She found out that she has the genes for breast cancer. And what did she do? She did the preventive thing. She took out both breasts. And so she doesn't have to deal with that anymore.
There are certain things, Dr. Ilukweju again.
Yes,
I mean, you know, this life, this so-called life that we are, you know, once again, is very mysterious. You know, things that we do, things that we don't do make a difference. Some cancers are preventable. You know, if somebody smokes a pack of cigarettes, you know, or 2 packs of cigarettes a day for 40 years, you're more likely to develop lung cancer. That's a fact. But there are also people that smoke 3 packs a day for 50 years and they don't. You know, but we know for sure that if you smoke a lot, your chance of developing lung cancer is very high. So the thing that you can do to prevent yourself from developing lung cancer by not smoking. Same thing with breast cancer that we're talking about. It's prevention, it's early intervention. You know, many cancers affect older people. You know, the older you are, the more you're likely to get cancer somehow because your cells are aging. You know, and that's one of the reasons why. To digress a little bit, when women come to me for their annual checkup, you know, especially people above 40, I send them for pelvic ultrasound, you know, and they might say, why? I don't have any symptoms, you know. Then when I look in the chart, maybe they have a little cyst some years back. So those give me a reason to send them for one, you know, and most of the time it will come back okay, you know, because I've known that people that develop ovarian cancer, at one time or other, their ovaries were normal. And then by the time they show up with stage 4, which is as big as a grape, they're ready to die. That didn't go from normal to a grapefruit in one day. It takes time. And the only way to know that is to do ultrasound from time to time. So I encourage my women to do ultrasound every 2 years, just to check, because just never know. So it's very unpredictable, this life that we are in. But we physicians, we healthcare providers, you know, we are there to guide, to protect, and to help you guys. But one thing that you have to do, you have to come to us. You know, you have to spread the word. You know, tell the younger ones, you know, do your checkups. Men are better than men. Men are better than men. I always tell my women, if you want your husband to stay with you, to be with you, to raise your kids with you until old age, you got to grab him and take him to see doctors. You know, because men die earlier than women. You know, so cancer is basically early detection, and that can only be people doing their annual checkups. And that's what I have to say.
Thank you, sir. And, I totally 100% agree. However, healthcare providers, we have a responsibility also. We have a responsibility to listen to our patients and to assist them in doing the needful. My niece, Rita, died last year on May 26th because of late diagnosis of breast cancer. She felt her own lump. Most women who we find to have cancer, and men, they find their lumps. And it's why we recommend that you do your breast exams at least once a month. She felt a lump. She wasn't comfortable with it. She went to her doctor, and I would not mention what organization this is, because I just will not mention. And the doctor refused to even check her or test her because he said, you're too young. Just as we saw in that video that Dr. Azumah said, Dr. Azumah showed us where the young lady was told that she's young, it's nothing, don't worry about it. And then he ended up being, he ended up being aggressive breast cancer and had metastasized before she now had intervention and had to have have 18 rounds of radiation, something like that, after chemo. It didn't have to go that way, but thank God she's still alive. But my niece was not that lucky because she kept going back and back. And it was almost a year later that she actually forced a doctor and, kind of use the fact that the doctor was pregnant, that, look, if it was your child in your tummy right now, would you please just do mammogram and see? She sent her to radiologists, and radiologists called the doctor while my niece was still in the radiology department, that this is cancer that has spread to the chest wall and was no more contained. And she didn't make it. She suffered for years. So early diagnosis is important. I appreciate what Dr. Ilukweju said, that, she sends his patients to do pelvic ultrasound or intrauterine ultrasound to check for ovarian cancer, which we don't have means of checking. Pap smear that we do checks for cervical cancer, not ovarian cancer, but it does it every 2 years. I'm going to post Dr. Ilukweju's information in here if anybody is interested in, seeing him, because that's the kind of doctor I want to see.
Now, great. Thank you so much for pitching me.
No, sir. I'm not trying to pitch you. This is what I'm saying.
Yeah, I know. I'm
just take responsibility, and when the healthcare provider does not,
I'm just joking a little bit. What I'm saying is, yeah, I mean, it's great, because medicine is a profession. Medicine is a calling. Some people are called, some are not. So it's difficult for a patient to know the right doctor to go and see. Sometimes, your friend will say, this is a good doctor, go and see that person. That person may not be the best person for you. It's a two-way street. What I'm trying to tell our listeners tonight is that you got to take your own health into your own hands. When you go to your doctor, speak up. Sometimes don't be scared of the doctors. Don't let the doctor be the only one talking. If you feel like, and you want something, ask your doctor. Doctor, sometimes I have pain on my side. Sometimes I have some pain in my back. Sometimes, don't let the doctor dismiss that. Challenge the person. If they say, "Oh, it's nothing," say, "How do you know it's nothing? Can you see through my skin to know what is inside my body?" So it's I've saved quite a few women from what I just said about doing some tests that somebody else may not do because it's not part of your regular routine checkup. So the doctor has to think outside of the box. Sometimes you have to do some things that your colleagues don't do. But why do you do that? Well, I don't know. It's an individual thing. We practice medicine differently. Medicine is an art, not a science. So you have to find the right person that fits you. But most importantly, you must always speak up for anything that you challenge the doctor. How do you know? Have you done this test for me? And stuff like that. So it's a two-way street. Yeah.
And ultrasound has no radiation. No, So, Dr. Ilukweju, there's a question here. This one is for you. Is there a percentage of intraductal papilloma forming, changing, or developing into cancer?
Percentage of intraductal
papilloma changing into developing, forming, or changing into cancer?
Well, that the papilloma, I don't have the percentage. I'm not a breast specialist, so to speak. But that's supposed to be a benign condition. So to tell you the percentage, I can't safely say I know. But it's a benign condition.
The thing is, when something is benign, it means that it is not cancer.
That's right.
It won't form into cancer. It will not develop into cancer, Sister Shalom. So don't stress it.
But if it shows some type of lump, before they can say it's a papilloma, obviously there must have been they must have done some biopsy, because it shows up as something on mammogram, or somebody felt something, because most of the lumps in the breast, majority are not cancerous.
That's right.
Majority are not. Probably like 80% or 90% of lumps in the breast are not cancerous. So just because you have a lump in the breast doesn't mean it's cancerous, but you still have to check it up. Most younger people have, teenagers have lumps in their breast, but they're mostly fibroadenomas, which are benign, non-cancerous tumors. So, but once something is felt or noticed on sonogram or mammogram, then it has to be investigated further before the patient can, rest easy, and the doctor can rest easy as well. So once they do the biopsy and it's a papilloma and it says benign, they might tell that person to be a little bit more aware, to make sure that they don't miss their annual mammograms, more than somebody else because of that finding, which is benign, but it might, predispose that person to development of something more serious, down the road. So they'll keep a better eye on that person. Let's put it that way. But it's not a cancerous condition, but it just means that the person has to be more aware.
Yeah. Thank you. Thank you, sir. Sister Shalom, fantastic. Kindly unmute and ask, give us more insight into that writing you wrote. You are muted. Go ahead. We can't hear you. You are unmuted, but we cannot hear you. Nah. No. You're very, very faint. You're faint. No, we can't hear you. You know what? You may want to go out and come back in and see if that would work.
Okay, I'll do that. Thank you.
Oh, wait a minute. We can hear you. Go ahead. No, we can't hear you again. Okay, go on out and come back in and let's see. Okay, so Dr. Izugu asks a question here. Sister Shalom, go on out and come back in. I will treat Dr. Izugu's question. It says, comment on screening for ovarian cancer. Dr. Ilukweju, screening for ovarian cancer.
Like you said earlier, there's no easy answer to that question. Some people will come to me and say, I heard of this test, CA125. I need that test done, but it's not really approved by the FDA to screen for ovarian cancer per se, because many other, things in the pelvic or in the body can show that protein to be high in the body, like endometriosis and other stuff that are non-cancerous. So it's not a universal test for ovarian cancer. The only time we use it is if somebody has a suspicious mass in the pelvic cavity by the ovary, then it might be useful at that time. But just to come and say, do this blood test for me because I heard that you can tell, detect ovarian cancer, that's not really true. So having said that, the best way is basically to go for your annual checkup where a pelvic exam is done to see if there's any lump or mass in the pelvic area. And if the doctor is a little bit more kind, once again, if he cannot feel very well, because even the best gynecologists cannot guarantee that they can feel everything during the pelvic exam, especially if the person is a little bit overweight. So that's an indication right there to do a pelvic sonogram. I cannot tell you that everything is fine if I cannot feel everything.
Mm-hmm.
You know what I'm saying? I can do your pap smear to check for cancer of the cervix, but when it comes to the ovary and the uterus, I cannot say that any gynecologist can safely tell you that everything is fine because she just cannot feel everything. So, and the second eye to help us will be the sonogram, you know, that can peek inside the body and tell you the condition of the uterus, the ovaries, and the tubes. So that's why I use it liberally. It's a cheap study. It's not painful. There's no radiation. And so if anybody is not using it, if your doctor is not using that liberally for you, who's doing your pap smear and all that, they're not really doing you any good or any service at all. And that's the only way, the best way to tell you that the ovaries are normal. And that's only good for 2 years.
Mm.
Years later, you can ask, can you do me another sonogram, doc? And say, why? I just want you to do one. Are you able to feel everything? Can you guarantee me? He said, no. Okay, then do a sonogram. So that's the answer.
Thank you. Thank you. Sister Shalom, you want to try again?
I'm so sorry. I'm trying to get it to work properly.
We can hear you. Go ahead.
Okay.
Yes.
So the reason why I asked the question because I know that the introductible papilloma is demonic, but it's like okay, because I've had that, and I've experienced the bleeding of the breast through the nipple. And I had to have emergency surgery, and I had to have my duct cut out. And then 2 years later, it happened again in the second breast, in the other breast. And I had to have emergency surgery as well. And that was cut out. Now, in March of this year, after my first surgery, I was instructed to have a mammogram and an ultrasound every 6 months. And then as of this year, so after the 2 surgeries and this year on March, I've had it a little bit again, but these are different doctors and they weren't so quick to tell me to have another surgery. And there's also a lump that is being watched, but that lump has not grown in a few years. So that's like the size of a strawberry. I'm not one of those that are scared to go to the doctor. I'm not nervous about it or anything. I just wanted to know if there was a percentage because it's like after the first surgery, my breasts have become very dense. So that's why I have to have the ultrasound because it's hard to see everything. So I was just wondering what percentage, if there was any, and how many times is this gonna come back or why is it coming back? I've had the BRCA test and, because my grandmother, she had a mastectomy, but I think it was her left breast, but I don't have that trait. So that's why we got them.
Excellent. Excellent question. Dr. Lupe Jusa.
My question or comment is, if with all these surgeries where they're removing some tissue and testing them, at any time did they tell you there was any cancerous cells in them at all?
No, I was told that I'm catching everything in time.
Yeah, I mean, you're doing the right thing because you stay on top of it. And obviously, your doctors are also doing the same thing. Short of saying, let's remove the whole breast, which obviously they won't say that, but they don't see anything that is life-threatening. It's uncomfortable. It sounds like you're somebody that developed a lot of lumps, and there are some people like that.
I do have, yeah.
Right. You develop, we call those kind of person a lump former or a cyst former. Some people form cysts all over their body. They have cysts in the ovary, in the breast, in this and that, under the armpit. Those people are predisposed genetically to developing cysts and lumps. But they're usually all benign, but they're uncomfortable, obviously, and very scary for the patient. And I think you are just one of those. And thank God that you're still on top of it, and your providers are also doing the best they can. And that's all you can do, just stay on top of it. Yeah.
Okay, thank you.
You're welcome.
Thank you so much. Dr. Elekwejusa, you are awesome. Thank you. And I want to remember Medical Mondays family about a conversation we had when Sister Rosemary said we all need to come together to know each other physically. And Mr. Okusanya said we have NAPAC Gala coming up in November. And why don't we all meet there? Because they are from California and they can make just one trip, because Maryland, right where we are, is where we're hosting that NAPAC Gala. Please, if you have not registered for the gala, kindly do so we can meet in person. You can go to napacusa.org. I'm putting that out there now. napacusa.org. NAPACUSA.org, and book for the gala. It's $100 on November 4th. We're also going to have a cruise on November 3rd, and that is closed, but I found out today that there may be the possibility of three spaces still left for the cruise if you're interested, November 3rd. But then you have to do it like now. And the cruise is in Baltimore City on that Friday, November 3rd, at Baltimore City Cruises, and it's $99. We got it at a mad discount. The gala is November 4th, Saturday, in Glen Burnie, Maryland. I look forward to seeing you all. Go to napacusa.org or hit me up by text, email to ask for further information. It's Breast Cancer Month, and I'm grateful for Dr. Azumah and Dr. Ilukweju, and Dr. Ilukweju taking us back to Africa during this conversation, because we've seen a surge of cancers, especially breast cancer, not just here in the US, but also back home in Africa. It is the same all over. And I pray that we would all take heed and do the needful, see our healthcare providers as necessary, at least once a year. That once a year would dictate when next you need to see your healthcare provider, your primary care doctor, and for women to see their GYNs, to do the needful female exams. It is very important at, over 40, I believe. Sir, would you say that it is important to do those ultrasounds to check for ovarian cancer? We do not have a test for ovarian cancer. So doing the ultrasound to just monitor is great and can save your life. We do much better catching things earlier, preventing first, and sometimes it's beyond us, but catching things earlier than later. When we catch it later, usually, we palliate. And so we'll encourage that we all, stay plugged in and make sure that we're on top of our health. If anyone smokes on this platform, please, please, please stop. Use modalities that may be necessary if you cannot quit cold turkey, but quit. because smoking does a lot of bad things. It's not, the subject is not on smoking cessation tonight, so I don't want to, expatiate too much because I will start another conversation. But please stop smoking. Oh, sister, this one is my daughter. Adiola Atekoja said she's registered, looking forward to meeting me. Woo-hoo. Thank you. Thank you so much. She's joking. We see quite a bit. We go to meetings together. She is amazing. So she took me back to napacusa.org. So if you have any other questions, please raise your hand or put in the chat box. Otherwise, we'll see you next week. But before we do that, Dr. Ilukwejusa, would you give us a parting word to close this session?
The parting word, I've said it so many times during this discussion. It's not my lecture. I just happen to chip in. Life is unpredictable, okay? We have one life to live, you have only one body, to carry you out, to carry you throughout this life. So you have to be good to it. You have to be kind to it. Also know that you are the captain of your own ship and the master of your own destiny. Nobody will do it for you. He gotta be the one. Your husband is not going to do it for you, and you're not going to do it for him. You can watch each other's back, but you have to always look out for number one. So when it comes to your health care, if you're not healthy, you cannot take care of other people. And prevention is better than cure. That's what we've been saying all along. So basically, please do your annual checkups. So that's very important. For men, prostate, blood pressure, also for women, of course, diabetes, all those things. But when it comes to things that you cannot see, like the ovaries, the breast that you cannot really, then we should all make sure that we do our mammograms, and like I said earlier, ask for your sonogram to check for your ovaries and all that. So basically just do your annual checkups, and that's all I'm going to say. And thank you so much for listening.
Thank you so very much, sir. God bless you. And we're looking forward to your talk coming up in a couple of months. And thank you for being here and, just taking the tail end for Dr. Azumah last minute. Appreciate you a lot.